One wrong code and the obstetric case fails. If you're using general ICD-10 logic in obstetrics, stop. Welcome to Coding Doctor, where we think like examiners and auditors. In this video, I'll show you critical Chapter 15 slides first and explain them with real scenarios so you understand exactly how to select an obstetric principal diagnosis. Stay with me. Routine outpatient prenatal visits with no complications. Let's start with the simplest scenario. When a patient comes for a routine outpatient prenatal visit and no complications are present, the first listed diagnosis must come from category Z34 and counter for supervision of normal pregnancy. This is very important. Z34 is used only when the pregnancy is normal. No Chapter 15 complication codes are allowed with Z34. So remember this rule clearly. Z34 codes should not be used in conjunction with Chapter 15 codes. If the provider documents any complication, even something mild, Z34 is no longer appropriate. Exam tip: if you see words like routine, normal pregnancy, no complaints, no complications, Z34 goes first, nothing else from Chapter 15. Supervision of high-risk pregnancy.
Now let's move to high-risk pregnancies, which are coded very differently. For patients with high-risk pregnancies, we use category O09, Supervision of high-risk pregnancy. These codes are used only during the prenatal period, not used during labor or delivery. So for routine prenatal outpatient visits in a high-risk pregnancy, O09 is the first listed diagnosis. Now, here's the key distinction. Z34, normal pregnancy. O09, high-risk pregnancy. And unlike Z34, O09 can be used with secondary Chapter 15 codes if appropriate. For example, if the provider documents a condition related to the high-risk status, you may assign O09 first, followed by the applicable Chapter 15 code. Now, what happens at delivery? If there are complications during labor or delivery, you do not use O09. You code the actual complication from Chapter 15. If there are no complications, you assign O80, in counter for full-term uncomplicated delivery. Coding logic to remember. O09 is prenatal only. Once delivery starts, it steps aside.
Episodes when no delivery occurs.
Next, let's discuss encounters when no delivery occurs. In these cases, the principal diagnosis is the principal complication of pregnancy that required the encounter. This could be hypertension, diabetes, preterm labor, or any other pregnancy-related complication.
Now, here's an important flexibility rule. If more than one complication exists and all are treated or monitored, any of the complication codes may be sequenced first. There is no strict hierarchy here. Exam insight. When multiple complications are equally managed, ICD-10 allows coder judgment in sequencing. But remember, the diagnosis must be from Chapter 15, and it must explain why the patient was seen.
When a delivery occurs.
Now we come to the most tested and most confusing section. When an obstetric patient is admitted and delivers during the same admission, the principal diagnosis is the condition that prompted the admission, not the delivery, not the outcome, not automatically O80. Ask yourself one question: why was the patient admitted? That condition becomes the principal diagnosis. Now, if multiple conditions prompted the admission, you must sequence the condition most related to the delivery as principal. Any complication of delivery is coded as an additional diagnosis.
Cesarean delivery. Special rule.
Cesarean deliveries have a very specific sequencing rule. If the patient was admitted because of a condition that led to the C-section, that condition is the principal diagnosis. But if the patient was admitted for a completely unrelated reason, then the reason for admission is the principal diagnosis, not the condition that caused the C-section. This is a classic exam trap. Always link the reason for admission, not the procedure itself.
Outcome of delivery.
Finally, let's talk about outcome of delivery. Whenever a delivery occurs, you must assign a code from category Z37. Important rules. Z37 codes are used on every maternal record when a delivery occurs. They are never used on subsequent maternal records. They are never used on the newborn's record. Think of Z37 as a reporting code, not a diagnosis. Memory tip. One delivery equals one Z37 equals one maternal record only.
Key takeaway summary.
Let's quickly recap the logic. Normal prenatal visit, no complications, Z34. High-risk prenatal visit, O09. No delivery, complications treated, Chapter 15 complication code. Delivery admission, condition that prompted admission. Every delivery, add Z37 on maternal record only.
If you master principal diagnosis selection in obstetrics, you've already crossed 50% of Chapter 15 logic. In the next part of this series, we'll move deeper into pre-existing conditions versus conditions due to the pregnancy. Stay focused, stay consistent, and keep coding smart. Thanks for watching this video. See you in the next video. Bye-bye.